Today we're going to talk about how to get out of knee pain when you're squatting. So first, if we're having pain when we squat, we need to modify and unload the knee so that we can still train without experiencing pain. Whenever you're dealing with an injury, you still want to train what you can train to make sure that you're still getting that same stimulus to the area, getting blood flow, and getting the load that it needs to not only heal, but get back to the ability that you were at prior to the injury. That's no difference with the squat and when we're experiencing knee pain. So what we want to do is if we're having pain with a, let's say, front squat, we might want to shift the weight back. So if I get down and going down to here brings me pain, I might have to switch up and shift that load back more into my hips and bring that load away from my knees by going towards a back squat that's a more hip hinge dominant position. Getting here and then working on my depth and still getting some strength to my knee. But what if back squatting still hurts my knee? Okay, then I need to regress it another step further. We can grab a box, and now you can change the height of that box or bench that you use to control the depth and load to your knees as well. So if I get down or get to my barbell, and when I come down, if that's still painful through my knee when I get down to that box height, then I want to increase the height of that box further to take the load off my knees, but still get that good training stimulus in so I don't lose everything that I've worked toward these past couple months prior to injury. So finding a way to unload the knee in a comfortable position where you can still train is going to be the first step in getting you out of knee pain right away. Now, step 2 for getting out of knee pain is figuring out where are these mobility deficits potentially coming from that are leading to all the pain in my knee when I'm going down into the squat. Now, might not be the case for everybody dealing with mobility deficits, but if you are dealing with an injury, now's the time to take a step back and focus on those potential limitations so we can make sure that they're addressed and they don't become an issue once you start feeling better again in the future. So, the second thing we want to clear up is any mobility issues that might be around the knee. So looking at our hip and looking at our ankle. Now, these are some common ones. These might not be the ones specifically plaguing you, but this is where we can get a good start to see if these might be the things that are limiting us. So to start, taking a look at our ankle mobility and getting our foot up on a box here to see how far we can get that shin over our toe here. Now, if we're having limited ankle mobility, that's going to lead to more load through the knee when we try to get down into those deeper squat positions. So to try to work on this, just like how we assess it, making sure I can get my knee over my toe and get a good shin angle, I'm going to use a box, and I can use even the handles here and drive that knee over my toe and hold in there for about 5 seconds at a time, and then I can work and push that knee in a little bit, holding again for that same duration, and I can also work out as well. Find the position that is most tight for you and work into these areas for about 60 seconds total prior to training so we can start opening some things up and creating more mobility through the ankle and up at the knee as well. So that's the ankle. We also want to look at the hip as well. Now, typically, the ability to rotate the hip into external rotation is what usually limits people. So an easy thing, again, to do with the box, flip it up to a taller height and get in this elevated pigeon position. Again, I'm going to work here, and I'm going to assess just going back, adding a little twist in and out, working all 3 of those positions for about 60 seconds and seeing which one feels the most limited to me and really focusing on that spot to help open up my hip so that everything tracks well when I try to squat and I work on retraining that movement. Now again, we want to do all these prior to training so that we open ourselves up and are able to train through this new range of motion that we've acquired. Then lastly, the third one here is opening up any of the quads, rectus femoris, any of those front side hip flexor muscles here. Again, we can use the box, Put it to its lowest height, 20 inches here. And we can do an elevated or a couch stretch here. Getting our knee down on the pad, foot up on the box. Getting here, I'd recommend wearing shoes on this box because it does not feel good. And holding here for about 60 seconds, we're gonna try to open up this front side. Now working through these 3 stretches here, in addition to foam rolling before you reach into here to see if there is any soft tissue restrictions that you can help alleviate, will help enhance that mobility that you can get from these 3 stretches. And then going into training the squat to a tolerable pain range is gonna help you get out of pain and slowly build back up to squatting like you used to before you had knee pain. Now, lastly, third thing for getting out of knee pain when we're squatting, we want to reload the knee safely here and without increasing the pain to the area. So we talked about how you can regress your squatting to a point that's a tolerable level of pain. Now, what's a tolerable level that's not going to overdo it, but still give you the benefits of strength training, right? So we want to work no more than a 3 to a 4 out of 10 pain, and that pain should be gone later that evening and the next day. If it returns, whatever you were doing was too much to the area, and we need to scale back just a little bit more to a point that's tolerable for our knee, where it's not irritating, it's only stimulating. So finding a way to do that, whether it is just a body weight squat for a few days while focusing on mobility, and then slowly returning to the squat, whether it be box squats, back squats, or front squats, based off how serious the injury is or where you've been. Now, if you still have a hard time just squatting, a good way to start is adding in some isometrics and some other modified variations that we can do to try to load the knee. A pretty simple one is, this is the lowest level. I'm gonna find a wall, I'm gonna go down to a point that's tolerable where I can still load my quads but not irritate my knees. I wanna work into a little bit of pain with this though, so I can build a tolerance to that pain and then let my body know it's safe, so that it slowly goes away over time, and then I can start doing more. So I get down, okay, right here is where that painful stimulus is for me. I'm holding for 45 seconds, and I want to work through this for 5 rounds here to start. Now, if that wall sits pretty easy, you're going to parallel, and you're like, oh man, I need to start progressing a little bit more here, then we can start getting into a split squat, and then finding that depth that's tolerable for us, but not, again, irritating the knee, only stimulating. Again, working through that 3 to 4 out of 10 pain level, that's gonna do good for our knee and not hurt it any further. And work through that same kind of time frame, 5 rounds, 45 seconds, to help build up some load tolerance to that knee so that you can get back to squatting. Once you're able to handle all those isometrics fine, then we'll talk about getting back into squatting and working down to, again, a depth you can tolerate after you've worked through your mobility exercises to help really maximize how far down you can go and truly only be limited by your knee pain itself. Now, this is going to take time, and if you need help and it's just not getting better, reach out to somebody that understands your injury and your sport, right? Find a physical therapist that has some knowledge in what you're trying to get back to, so they can best help you return to whatever it is at whatever level you want to do, right? Don't just go to any old physical therapist down the street and expect them to understand where you're at. That's where you can either talk to someone like me at Cornerstone Physical Therapy or someone in your area that understands your sport. Our job is to try to get you back to your goals and meet them, not just get you back out of pain. We want you to stay out of pain. I hope these videos helped. Reach out below if you need any help or have any questions, or reach out to us on Instagram at Cornerstone PT.